Dr. Pisarenko here, Plastic Surgery Westchester. So today we have a lot of questions about blepharoplasties. So the girls compiled a list of questions, so I'm going to read them off and answer them for us. How long is the recovery time after blepharoplasty, and when can I return to normal activities? Excellent question. Really depends if it's upper blepharoplasty or lower blepharoplasty. Upper blepharoplasty, most people are sort of back to their regular activity in about a week. In terms of work, exercise usually takes about 2 to 3 weeks to start up again. Lower blepharoplasty takes a little bit longer. Most people are out and about at about 7 to 10 days mark, and then most of the bruising is gone by 2 weeks, and exercise can be resumed at about a month. In terms of how long it takes to really heal from that, it's about 2 months from the lower bleph. Are blepharoplasty suitable for people of all ages? Or is there an ideal age to consider eyelid surgery? Every patient is different. We've operated on patients who are as early as in their 20s for having herniation of fat in the lower eyelid and really improve the contour of their eyelid. And also we've operated on women in their 80s. So it really depends. There are a lot of things that can play factors into developing hooding in the upper eyelid or bags under their eyes, genetics, lifestyle, smoking, sun exposure, age, of course, and all those things play into the decision making for the patient and also for us. So there's no really ideal age as long as the patient is healthy and has realistic expectations. How long do results of blepharoplasty typically last, and do eyelids continue to age after the procedure? That's an excellent question. I believe all of these operations are to be a reset. But there are certain things you can't control, obviously aging. So as we age, our skin thins out. There's less elasticity in the skin, more laxity. So with time, skin stretches and doesn't contract back. So absolutely, sometimes the skin can stretch, but as soon as you do the procedure, the aging process starts up again. Will blepharoplasty leave scars, and how visible they are after surgery? Another great question. Any surgery really leaves scars. Whenever you excise skin, there are scars. The good thing about the eyelids is it's very unusual for those scars to be visible. At most, they look like little skin folds, like a little wrinkle, and at best, you can't even tell that anything was done. And we try to hide these scars with the natural skin folds. Like for the upper eyelid, we really try to hide it in the fold where it's naturally occurring, so no one really sees that scar. Can blepharoplasty be performed on both upper and lower eyelids at the same time? Absolutely. We frequently do that. It's called four-lid blepharoplasty, and we're able to combine the two to really rejuvenate the eyes on the patient. Can blepharoplasty be performed on patients with certain eye conditions like dry eye and glaucoma? The answer is usually no. However, it really depends on the situation. And in those types of situations, we work closely with our eye surgeon and eye doctor colleagues in order to discuss if we are able to do the procedure. Can blepharoplasty address conditions like ptosis, droopy eyes, in addition to cosmetic concerns? The answer is no. It's a completely different operation. A blepharoplasty is just excision of eyelid skin. Ptosis is usually within the actual structure of the eyelid, and those operations usually tighten up the muscles or the ligaments within the eyelid to really focus on fixing the ptosis. So can a blepharoplasty be done at the same time as ptosis repair? Absolutely. But again, a blepharoplasty itself is not repair of the ptosis or droopiness of the eyelids. Can blepharoplasty be combined with other procedures like facelifts and brow lifts? Absolutely, and we frequently do that. There's no need for someone to heal twice. There are different blood supplies to the eyelids versus the face, so we frequently combine facelift with upper eyelids, lower eyelids, or both. So it is a common procedure to do. In fact, we also have done blepharoplasties as well as body procedures. If you have any further questions about blepharoplasty or anything else, please feel free to email us at info@pswdocs.com, and we'll be happy to answer them either personally or in this forum.